So today our council is recommending that Canada implement a universal, single-payer, public national pharmacare program.
Universal pharmacare for all Canadians. It may sound like a daunting task, but the advisory council created by the federal government believes it can happen. The council released its report in Ottawa.
This will ensure that all Canadians, regardless of where they live, regardless of their employment status or their income, will receive a consistent standard of prescription drug coverage.
Canada is the only country with universal health coverage that doesn't have a universal pharmacare program. The council estimates the program will cost Canadians $15 billion a year once implemented. But Hoskins says it will leave Canadians with more money in their pockets.
We estimate that our recommended model of universal single-payer public pharmacare will save Canadian households on average $350 per year. We further estimate that employers will save on average $750 per employee.
The council recommends having the final system up and running by 2027. It recommends creating a national drug agency that would eventually help save money on the cost of drugs. Despite the optimism, the Conservatives aren't buying it.
I don't believe that anybody thinks that when Liberals announce multi-billion-dollar spending programs that they're going to save money.
On the other hand, the NDP, who have long been calling for a universal program, say the time to move is now.
We're deeply disappointed that the Liberals have again not committed to actually bringing that to bear. Also the timelines, they're talking about 8 years. Any additional time is more time where people are going to be languishing in emergency rooms because they don't have access to the health care that they need and the medication coverage they need.
The council says these goals won't be achieved immediately, so instead they're recommending a gradual implementation.
We're recommending that the government take a phased approach to implementation, beginning immediately, but launching pharmacare on January 1st, 2022. Beginning with a list of commonly used medicines, often called essential medicines.
Canada's health minister says she is still reviewing the report, but has already taken steps towards a universal plan by setting aside money for a pharmacare agency. In Ottawa, Nigel Newlove, City News.